Thank you for joining us on Journey to 600. Today we're going to be focusing on debridement and types of exudate, which fall under the other systems category. So there are two types of debridement, non-selective and selective. First, I'm going to be going over non-selective. Wet to dry is when you take a wet gauze of some sorts, maybe it's soaked in an ointment, maybe it's just wet, you put it on a wound, and then when it dries, you take it off. This can be very painful for the patient because it removes not only bad tissue, but good, healthy tissue. Then we have surgical debridement. This is where an experienced practitioner or surgeon excises devitalized tissue to the base of bleeding tissue, so good, probably healthy tissue, as well as the perimeter of the wound. Next, we have pulse lavage with suction. This is when somebody uses sterile irrigation with pressure spray and suction. So, this is basically how I would describe it and that I have seen it. It is like pressure washing a wound. I was on the burn unit during one of my rotations, and they would do this. And they would like put the patient on like a light sedation because it is very painful for somebody who is awake. Then we have whirlpool, which is not commonly used anymore because I think of like bacteria and like there was some research that doesn't really support its usefulness. But I feel like it was really popular about 20 years ago. But basically, it softens the necrotic tissue and you need to disinfect it after every single use. Next, we're going to be going over selective debridement. Sharp debridement is considered the gold standard for necrotic tissue removal, but it is contraindicated for vascular wounds and adhered necrotic tissue. This type of debridement spares all healthy tissues. In this method, the practitioner only removes dead, devitalized, hanging tissue and does not probe or cut into tissue to reach bleeding tissue. This is why adhered necrotic tissue is a contraindication because it is adhered to that healthy tissue. And this is also what makes it different from surgical non-selective debridement because surgical is going to get down into that bleeding tissue. Next, we have chemical or enzymatic debridement. Currently, there is only one single enzymatic debridement agent on the market, which is, oh gosh, I'm going to butcher it, cholingizyme. These agents enzymatically cleave or destroy the dead tissue from the healthy skin. We have biosurgery, aka MDT. This is rarely used, but sterile magnets can be placed on a wound as they eat away at dead tissue. Then we have autolytic. All wounds undergo the process of autolyzation. In healthy individuals, this process is short and occurs during inflammation phase. In chronic wounds, we use dressings to facilitate enzymes and moisture to rehydrate, soften, and finally harden into eschar. This can be achieved through different types of wound dressings that I have gone over in my last video. All right, now we're on to exudate. So I have the serous exudate first. This is a clear, forgive my typo, thin, watery fluid. It's usually observed with acute or mild inflammation. And also, forgive my blurry pictures. You'd be surprised how hard it is to find a good photo on the internet. So please forgive these following photos. Next, we have sanguineous exudate, and this is when it is a bright red color on the gauze or sheet or whatever it's on. It's just bright red, and that's because it is fresh bleeding. Next, we have the serous sanguineous exudate, and it contains serous drainage with a small amount of blood present, which gives it more of a pink color. You'll notice that it is basically a combo name-wise of the two exudates I had just talked about. Next, we have the purulin exudate. It is thick and opaque. It could be tan, yellow, green, or brown in color. And this is never considered a normal drainage from a wound bed. It could be a sign of infection. So you need to notify a nurse or doctor if you ever have a patient with this colored drainage. Okay, our correct answer is C. All of the following are considered selective debridement except C, surgical debridement. Just a brief reminder that surgical debridement is very similar to sharp debridement. However, surgical is where a surgeon practitioner excises devitalized tissue to the base of bleeding tissue. So, this is going to interfere with that healthy tissue. And to differentiate against sharp debridement is going to remove just the necrotic tissue, sparing all healthy tissue. Okay, and these are your correct answers. Cereus sanguineus is that pink in color because it has that cereus and sanguineus, which is clear and red mixed together to make pink. Then you have serous drainage, which is going to be clear and can show signs of mild inflammation. Sanguineous is going to be bright red in color due to it being fresh blood. Then purulin, it could be tan, yellow, green, or brown in color, and it is usually described as thick and opaque, and this can be a sign of infection. Thank you for joining us on Journey to 600. Please like, subscribe, and turn on your notifications.